Welcome. I'm John Harris, a principal with DGA Partners. We're a healthcare management consulting firm, and wanted to share with you this video as the best way to demonstrate some interesting tools for analyzing bundled payments. There are a lot of challenges associated with bundled payment initiatives, and this video will focus on obtaining and analyzing the Medicare data. We've partnered with a data analytics firm with extensive experience with this Medicare data to help us provide the analytic, financial, and strategic support to our clients on bundled payments. Before the demonstration on the actual data analytics tool, I want to share a few PowerPoint slides to give you a sense of the challenges that lay ahead if you're pursuing bundled payments. The key challenges for provider applicants for this initiative are, first of all, the complexity of the Medicare data, the tight deadlines under which you'll be needing to analyze this data and reach decisions based on the data, the need to quickly understand what the data is telling you, engage your physicians in those discussions, and then do some deep dives into the data to understand what the opportunities might be for improvement. So this is a diagram indicating the process for analyzing the CMS limited data set files. You'll receive 7 files. You'll need to take those files, load them up into a data system, validate the data, get it cleaned up, remove outliers, be ready to analyze it, and then you're really going to want to enhance the data to be able to use it in your analysis. And you'll develop both standard reports as well as the ability to drill down. To get a sense of the complexity of the data, this is an example of one of the limited data set fields, the payment amount, and this is the description that your analytics team will need to understand to be able to figure out how to analyze the data. This is one field out of 170 fields that your team will have to get their hands around. So, this is a complex process. Some folks are partnering with others to analyze this data. Some folks are working with their internal data team to try to obtain that Medicare data and analyze it. If your internal team does not have experience working with these Medicare data sets, it can be a real challenge to try to get them loaded up and ready to analyze quickly enough so that you can then analyze them to develop your application. So we're going to shift now to the actual analytics tool that we have and the type of analysis that you can do. And you'll see here that we're looking at data from this sample data set, and this is a sample data set that we've developed. This includes data from Pennsylvania, New Jersey, and to a degree Maryland and Delaware. We're going to click into the Pennsylvania data, and we're looking at it here by major diagnostic category. And we're going to click in I want to click into orthopedics. Well, I clicked into the cardiac one. You can see that these are the cardiac MSDRGs. I'm going to move back and switch to the musculoskeletal so we pick up the orthopedics MSDRGs. And here we're going to focus in on DRG 470, the major joint replacement or attachment DRG. And this is a chart just of the number of unique episodes in the region for that. And we're focusing in here on a specific set of physicians and hospitals. And as we click here, we see actually for the whole region what the division of expenses are in the episode between the short-term acute care hospital, the physician payments, the skilled nursing facility payments, inpatient rehab, and home health. And you can see that a little more than half is acute care, but there's a significant portion for DRG 470 that relates to post-acute care. If we click in here and start looking by hospital, and we've subsetted this to a specific group of hospitals and specific group of physicians that we're interested in. The color coding here is a scale indicating the average cost per episode by hospital. So red is bad and green is good, and you can see that Hospital A has a high number of cases but a relatively high cost, and you can see that in the red, and Hospital F down here is the lower cost provider showing up in green. As we drill into this a little more and we look at a cut by physician, we're seeing some physicians performing particularly well and some physicians performing particularly poorly in this data set. So Dr. Byrne, though a very high volume provider, is performing poorly, and then Dr. Goodman below him, and Dr. Cooter even more so, much better. If we click in and look now at just the post-acute services and the distribution of expenses in the post-acute services, we can see that physician expenses are relatively uniform across all of the physicians, but this next bar, the red one, is inpatient rehab services, and you can see very wide variation for the cases that Dr. Byrne has versus the cases that Dr. Goodman has in terms of the amount of spending on inpatient rehab services. And you can see as I roll over the data here, or the chart here, the different components of the data come up, and you can quickly see what the components of the costs are. And here what you're seeing is the high costs that inpatient rehab generally has in association with these cases. If we look in here at Dr. McGann, just to indicate a particular way of drilling into the data, we look and we split for him the data between the two hospitals where he is practicing. You can see that he has very good performance in high volume. Let me go back there, sorry. He has very good performance in high volume on hospital B, but a lower volume, but apparently has very tough cases going to hospital G. So that's something worth noting, and something that I'm sure many hospitals would be interested in understanding. The next thing I want to look at is the sequence of care. So this is a different path down the analytic tree here, and this is looking at the sequence of care in the episode. And it's coded here, so all sequences start with A, meaning an acute care hospitalization, and then H is for home health, and C is a community physician visit. So those patients who get their hip replaced and then go to home health and community physicians have a relatively good cost profile. Those who go from the hospital to the community alone have an even lower cost profile. And you may be thinking here, okay, well, some of this is really related to the acuity of the patient, and that's right. But let's look in a little bit and compare this first episode with down here when we're looking at acute care going to inpatient rehab and then home health in the community. You can see that's some of the highest cost care, and many of the instances where skilled nursing is part of it are high cost as well. One of the reasons for pointing this out is it may seem that this is all just based on clinical differences of the patients being cared for, and as we've analyzed this data and dug into this, it turns out that it's not completely based on clinical differences, that there are significant differences that are simply based on practice patterns, historical preferences of physicians, even with clinically similar cases to the cases that other physicians treat in less costly ways in terms of the post-acute care. That's not been a focus for most hospitals in figuring out how to provide care. Now that you are focusing on it in a bundled payment situation, there are probably significant opportunities. And again, for the physicians as well, it's not been a focus, and it's a possible area of focus. Let's look now and dig in even deeper into this sequencing. And here we have the different sequences across the top, and the different doctors and the number of episodes that they have in each type of sequence. I'm sure you can imagine how sitting down with the doctors and looking at this data with them can be a very helpful way to engage them in thinking about how they might be able to improve results in a bundled payments situation. Another way of looking at the sequencing data is in these kinds of bubble charts, again with the color coding to help identify lower and higher cost approaches. And this is just one level deep. We can take this and then do the next level of analysis as well. This is another useful way to visualize the data. So we hope this was a helpful way to consider some of the options that are available for analyzing this data and some of the challenges. Please feel free to let us know if you have any questions or are interested in discussing how you might be able to use these tools. Thank you.